So I'm not a real doctor. I just play one at work. So I have a couple challenges today. One I knew about. One just came up recently. The first one is that it's my daughter's birthday today. She's 7. And she decided that she would start celebrating her birthday at 5 a.m. So I got up a little early, and I got in from Europe yesterday, so I'm feeling a little bit of a jet lag. But that's actually not the challenge. When we were getting breakfast this morning, she actually was running around like crazy. She was kind of like, ah. And she said, "This is the most exciting day of my life." And I thought, that's such a great feeling to know before you even start the day that it's going to be the most exciting day of your life. And I thought, how could I engender that spirit to the group here today and make it the most exciting day of your life? So that's the first challenge I have, is trying to make that happen, at least for one of you. That was my goal, just for one. The second challenge I had, which I didn't realize till later, is Bob and Amal gave such great talks that I'm not sure what I have left to say. So that raises the bar yet again. So my way out is to ask if there's anyone's birthday today. No? So now my challenge is maybe a little higher. But hopefully I stimulate some thinking for you today, as I saw some marketers in the room, some multi-channel people, some IT folks. I know some of my team is in the back. And I'll try to go quickly through the things that are maybe slightly repetitive today, but hopefully I can introduce some new concepts as we go along, from a marketing perspective. Okay. No? Yes. Okay. So, as a marketer, what I like to focus on is customer experience. So, I challenge you, and all of you who've been to Chinese hospitals, hopefully not for any service, is this good customer experience? And we know it's not, right? It's crowded, it's unclear, you have to see a specialist if you have a cold. There are many things that are wrong with this system. And I think it's our job, actually, to figure out how to make it better. Before we go into how we make that specifically better, I'll repeat a lot of the things you've heard today, maybe in a slightly different way. Obviously, China is an important market. This is a slide from my old alma mater that talks about GDP contribution and which cities it comes from. And as you can see, about 28% comes from China, with over 250 cities contributing to that growth, which is just an amazing amount relative to any other market around the world. Oops. The second thing is that we know, right, is that this has also led to great growth in the pharmaceutical market. And you can see hospital sales growing at around a 22% CAGR over the last 10 years. Obviously, that's slowed down to 12 to 15% over the last year or two, and probably for the future, and will continue probably to slow down as the market gets bigger and bigger. But still, healthy double-digit growth is nothing to sneeze at, given where I was coming from in the U.S. I think the big issue is that there has been a lack of innovation, and I hate to show a chart where my company's at the top. Actually, I love to show a chart where my company's at the top. But the reality is that when you look at it, no company has done a great job about this. This is an analysis, you can do it from your IMS data, of products that started selling since 2009, and how many companies have launched those. And so and then how much percent of sales it was for them last year. And you can see for most companies, sales from truly new products that came in the last 5 years is less than 10%, less than 5% for many companies. Now, a lot of this has to do with the very, very long access chain that we saw in the previous presentation, but it also reflects the fact that we struggle to introduce and sell new products here in China. And of course, this comes at a time with increasing price pressure. It was mentioned before, and you can typically see that impact over time as average prices per standard unit have really flattened out over the last few years. And they'll probably stay flat. I wouldn't think that they would grow necessarily or decline necessarily, but it creates a challenge for us. At the same time, you have the increasing number of sales reps, and Bob showed you the decline in the US and the growth in China, and I'll just reiterate both here, right? Which is that it's very clear that China is moving forward very quickly in terms of rep and MR expansion. And this is data from 2012, right? Most of you know your budget growth the last 2 years, so you can kind of extrapolate this number to some extent, which is probably now over 100,000 and cresting the peak that was reached in the US market. Okay, so what is our challenge as marketing people? Just to summarize. We have overall a lack of innovation in our market. We're selling a lot of old products. Aspirin is a good example as any. We have the challenge of price and profitability being driven increasingly lower margins due to healthcare reform. And we have this kind of war of reps as a channel. On the positive side, which was shown before, we have GDP growth and increasing healthcare access as our opportunities to grow further in the future. And that's all the stuff you've heard many times over. And I just summarize it here for you again. So what is the way that we as companies typically respond to this challenge? Well, we talk about ethical promotion, right? We need to promote the right behaviors from our physicians, from our reps, and therefore from our physicians more and more. We need to increase MSLs, right? Medical is the answer. We need to become more patient-centric. That's always a good answer. We need key account management, right, to increase the access. And we need alternate channels. And these are all very typical responses. And I say typical only because that's what happened in the US and Europe. And I think there's a lot of things we can actually learn from their experiences around this. And today, I'll spend most of my time talking about alternate channels and to some extent patient centricity in that concept. But these are all important dimensions which we need to capture as a company, or as an industry, I should say, in terms of promoting improved demonstration of value of our compounds. So what do we typically see in the market now in terms of experimentation of what people are doing? I think we can all highlight a number of smaller marketing initiatives. We all have great examples of those. But generally, so you do see this kind of concept of digital promotion that comes up. And I think a lot of companies have a lot of examples here. We can talk about those. The second you see is the call center, virtual medical representative kind of channel that comes up a lot as a predominant one. And then finally what people might call broad market or portfolio initiatives. I need to go deeper, broader, but to do it cost effectively, I need to add more and more products. And these are all reasonable next steps to take as we go forward here in China. But my major contention with this is that I don't believe these initial steps really work. Now, that doesn't mean they're bad things to do. I actually think they're very good things to do. I think I said you're conservative, right? I actually think people who say they're conservative are actually just smarter than the rest of us, to be honest. And that's because they're shrewd and savvy, and they make measured decisions. And I think that's actually a very good thing to do, because taking a full jump looks very different. So I took many full jumps in the US to get rid of reps and try to replace them with call centers, or replace them with e-marketing, or replace them. And generally, what was found is that we failed miserably and lost sales, considerable sales, when we did those kind of things. And that's because the step was just too far. The reality is that reps remain a really important component of the interaction with physicians. And I think that's especially true here in China. We need to improve how that interaction happens, and we need to augment how it happens. But it fundamentally still needs to be there. So we should be making these incremental steps, but we should also recognize what are some of the hurdles that don't allow them to work. And the first one is emerging intermediaries. So one of the challenges with, say, e-marketing per se, is that you still have a hospital administrator limiting the number of prescriptions the doctor has. And so it doesn't matter if you keep calling on them or give them more channels to call on, they still have a limit potentially in the number of prescriptions they can write, and that can't be solved unless you know that information on the ground. The other thing is HCP behaviors. And by this I mean, of course, as much as we talk about HCPs using internet for information gathering, the reality is the way they want the information is very much in real time. And you've heard this mentioned before. When we talk about, say, a web portal with a marketing team, I'm always a little frustrated because I can't remember the last time I went to a web portal. You go to Google and maybe you go to to a link from there. But generally, you get most of your information from an app on your phone. Right? That's feeding you aggregated information from various places. And so the challenge is that even as we've tried to adopt some of the digital marketing approaches, customers are evolving faster than we as pharmaceutical marketing people at least tend to react. The third piece is the requirement of business-to-business channels. So why do I say business-to-business channels? We have to recognize at the end of the day that our relationship with physicians is a business-to-business relationship. They are not consumers. I mean, they may use some of our products, but hopefully not. And they actually write our products for other people. So they are a business intermediary for us. And we need to recognize that there are certain requirements of a business-to-business relationship that are different from a business-consumer relationship. And so saying, why can't we create the Amazon of pharma, is kind of a silly thing because that's not the relationship we're trying to have. And I'll talk about some of the dimensions of that relationship that are really important when you consider multi-channel development. Okay, so this is a slide to kind of talk about emerging intermediaries. And I think one of the things to note is the fact that China is really many markets in one. Right? So this is the total city-level healthcare spending from 2011 for 30 or 31 provinces on here. I'm not sure how many I have exactly. But what you can see is there's a huge difference, right, between Shanghai and 19 billion RMB and some of the other folks, still big regions down here that spend much less, say in Nanjing at 2.1. And that difference just in the amount of spend leads to difference in terms of how policies are implemented, what coverage looks like, what access to medicines looks like, how physicians behave, and how consumers behave. And our channel approaches need to take that into account. The other thing to recognize about systems is healthcare systems like the provinces we have is that they're becoming more and more sophisticated about how they approach healthcare. So, one of the things, this is actually a slide from McKinsey, and it's actually based on more of a US model, although it is global in a sense. But I was actually surprised at how many of these things are already in place here in China, at least from what I've seen. So what this tries to map is how systems are adopting technology to increase the sophistication in how they deliver healthcare. And some of the requirements of that are that you have interlinked data endpoints, so universal IDs, treatment data, cost data. Many hospitals in China actually have a lot of this data. They don't necessarily know how to use it effectively, but they have it. Electronic medical records exist in different formats and systems, but a lot of this data exists and could be utilized quite quickly. And so once you have that data, and you start combining it with analytical models that are able to predict outcomes, or at least judge performance, and you provide then decision support tools behind that, you can actually radically change how you're delivering healthcare in a system. It creates an opportunity to, say, manage antibiotic care in an inpatient ward, or manage diabetes care in an outpatient setting. And implementation of these systems is happening. We have to recognize that that's happening, and will increase the diversity of experience and diversity of situation that we walk into. So if we think that diversity of cost containment is hard. It's not that hard, right? There aren't so many ways you can contain costs. But there are many ways you can manage a diabetic patient effectively through algorithms. And we need to understand that this is the way the market's going. So cost containment is the first issue that we face. But as payers and providers adopt more analytical methods, it actually gets more complex in terms of what we're dealing with, but provides us the opportunity, because now we're not just talking about cost, but talking about delivering value. The other thing that we have to recognize about the market here in China is that the engagement exists at multiple levels. And so when we look at opportunities and barriers to how we implement a plan, right, often we can implement a plan at a hospital level, but it could become quickly overridden by something happening at a city level or provincial level or a national level. And we need to really engage every level of the organization to build out those value propositions and understand the diversity of what we're being addressed with. So first hurdle for our challenge, for our marketing channels is the issue of emerging intermediaries and the diversity of that group. The second challenge is then the customer behavior I mentioned before. So I gave you the example of people get their information from their smartphone, not from a web portal. This is now generalized to marketing speak that people like me like to use after a while. So the expectations of customers these days are that you need to personalize information to me. I want information that's directed to me, right? I want it for my need, right? For the thing that I care about right now, when I need it, which is right now. Right? And that's a very nice thing, right? So if I want to look up the stock price of Novartis and find out what the latest analysts think, I can do that on my phone. And I can do it right away. And there's someone who's developed an app that provides that service for me. Right? I don't need to go to a website. It just comes, right, as I need it. And actually, right, they may actually even trigger to send me a note to say, look at the stock price because it moved by 3%. Right? Now, I shouldn't sell that because that would be a problem. But that opportunity exists, right, to intervene in a time-dependent way in decision-making of consumers. So what that means for us, typically in marketing, we've gone very much with a mass approach, core messages, and delivered in a programmatic way. So sometime in July, your executive team gets together for their strat plan. They set their priorities for the next year. The marketing team develops their strategy for the next year. We set the budget, we plan it all, and we go into 2015 with a plan, right? And we don't adapt that plan. We have our core messages. Maybe we change it a little bit. Maybe if something falls apart completely, we have to do something differently. But the reality is that we kind of create this big bolus of event and program that we're going to do from a marketing perspective. Well, your consumer doesn't think that way, right? Because they've read an article, right, about the treatment of or prevention of cancer by aspirin, or they talked to a colleague who had an interesting patient, or they had a patient complaint about something, right? They want information in a different way because they're confronted with that today. And that's not that they weren't confronted with it before, but they didn't have access to solutions as before. And that's the other thing we have to realize about this approach is if we don't provide the solution, someone will provide it for us. So it's not that the doctor says, I have this need, and I don't search for a solution because Novartis or Bayer or Merck or somebody else doesn't provide it, right? I will find it somewhere else. We have to recognize that that's reality. So we can continue on this approach, right? But the reality is the customers move to this approach. There are people out there thinking about what's the right customer with the right message and the right time. And there are people who want to actually provide that solution to our customers. So we need to move to that model, right? We need to identify who's our right customer, how do we get them the right answer to the question that they have, and how do we do it at the time they want it? Not in a call or event a month later, but at the time they want it. So that's the second change or barrier to development of new channels is this change in behavior that we have to deal with. And one of the things that requires is that we actually involve customers much more in our planning. So typically, marketing team 5 or 10 years ago, and maybe even today, who knows, would, in that planning cycle I mentioned before with the big bolus of program, there was probably an ad board somewhere. And we had the ad board. The KOL said, yes, we like your messages. That's a great program. I'll speak for you 5 times next year. Let's get my friend over from the US and do that. They're very happy. They like to work in that model. Right? But the reality is that that's not really involving your customer. Right? That's not really, the KOL probably doesn't even write very many prescriptions or see many patients. Right? They're not actually your real customer. You need to get your real customer involved. And one of the things, this is a IBM Global C-Suite survey, is that, and challenges to chief officers of different types. And one of the things that really you see shifting in the organization is organizational openness to customer involvement. And really where customers are getting involved is new product and service definition and product and service testing. Right? So how can we get customers more involved in this area is a key concern among global CEOs. And as you can see is that companies that do collaborate with their customers directly generally have higher performance than companies that don't. And I think this is a really important difference in terms of how we operate and in terms of how we think about interacting with our customers as we develop programs and channels in the market. So the last hurdle I want to talk about is in developing channels is this concept of B2B. So, right customer, right solution, right time. Right? That's great if I'm selling TVs. Because I, as the consumer, every couple of years I need one TV. Right? And I buy it. And if I'm a B2C company, the consumer makes that one decision, I'm going to buy a Sony. Right? And hopefully, as a Sony marketing person, I've reached them at the right time when they're making that decision and they do it. I was on the search engine site and Sony came up and I sold the Sony to that customer. But that's not our relationship with our customers. Our relationship with our customers lasts many years. Most of our customers will be with us their entire lifetime, with Novartis or with Bayer or with Merck. I keep saying the same companies over again. Sorry if I'm insulting anybody. It's just what's stuck in my head right now. Pfizer, AZ. I should say AZ a lot right now, just in case I don't get to say it again later. The point is that our customers live with us their entire career, and that's actually a blessing in many ways. We can develop great friendships, great relationships, but it's also a responsibility we have that when we interact with them through a channel, that we make sure that that channel has some dimensions beyond just right customer, right time, right solution, but also that channel really needs to have stickiness, it needs to have longevity, and it needs to have scalability. So I'll come back to this. So let's just start with stickiness. So what is stickiness? So, and by the way, these are my terms, so you can criticize them. I'll take feedback later, but it's the best I could come up with. I have a very limited vocabulary. So stickiness is the ability, right, of you to go back again with that channel. I've had vendors come to me and say, we can do an email blast, and we can reach 20,000 customers, and it'll be great, and we'll do this program, and we'll do it 3 times, and that's great, right? But how many times can you really reach a customer with an email blast? Right? It's after the first one, unless it's programmed in the right way. Right? After the first one, it's okay, maybe 50% open. The second one, another 50%, and pretty soon you're into diminishing returns. And so the challenge of a new channel is it has to be sticky. Right? The customer has to want to go back to it again and again because this is a relationship and a conversion model, let's be clear, where we convert physicians in terms of the amount they write for us. It takes a long time to develop. Many customers do not decide tomorrow to write 5,000 boxes of your product. Right? They decide over a few months after trial and error and experience on how many they're going to write. The other thing is longevity. Right? So that the customer wants to go back to it. It also has to last a long time. So in a sense, right, one of the challenges that I see in the marketplace is people build websites and then they forget about them. Right? They exist, and I'm sure at some point your compliance team or IT team came to you and said, hey, by the way, we have many artifacts in our systems that we've been maintaining for years. Does anybody use this anymore? Does anybody visit it? So longevity is a key issue that we have to deal with. And the last one is scalability. So, great thing about the pharma business is it's a big business. Right? I always talk to my parents about Novartis, and they have no idea what pharmaceuticals is, by the way. My parents were teachers growing up, and business to them, they don't understand why I did it. I should have been an academic, all these kind of things. But the reality is they don't know what the company is, right? And I say to them, well, we sell $50 billion, and they don't know what that number is. But the reality is it's a big business. Right? Most pharma companies are in the top 300 companies in the world. Many are in the top 100. And that means we are a big business. Right? And that means that we have big sales and we have big aspirations. It means we have to be able to scale our channel. A lot of e-marketing examples are cheap. Right? And it's cheap to do a 30,000 RMB product or a 100,000 RMB project or a 500,000 RMB project. The challenge is, right, that we spend a few $100 million a year in marketing and sales as one company. A few $1 billion, yes, many billion RMB as an industry in trying to reach physicians. And if new channels are going to have an impact, they need to be able to replace a large portion of that spending. Because 10-to-1 ROI on 50,000 RMB is great, but it's really a drop in the bucket. So scalability in channels is another big challenge, and something that we have to think about as we experiment is, can we really grow this channel into something that a lot of people are going to want to use, that I can put a lot of money into and get a lot of sales return out. So kind of 6 challenges all together. You got to get the right customer, right solution at the right time, but you need to do it through a channel that's sticky, that has longevity, and that I can scale. All right, so that's why some of the current incremental work we've all been doing is a little bit unsatisfactory because it doesn't have answered all these dimensions. So how can technology help us move forward in doing this? Is, I think, was the title of my talk, and I realized I haven't talked about technology at all. So I might as well do it. Three ideas. These are just what I think we need to focus on as we go forward in developing new channels. The first one is what I would call RoboRep. So as I mentioned from the beginning, right, we still invest a lot of money in reps. Yes, they will have diminishing returns over time. So that I think the companies that are best at driving the efficiency of their medical reps will be important. Multi-product is one way to do that. But you can also do that by enhancing the effectiveness to which they reach the customer directly. I'll discuss how technology can help us do that. The second is finding low-cost interventions, but not to the HCP, because actually that's very costly in many ways, and I think you need to think hard about how you do that. But actually, how can we do it at other points in the value chains that are becoming barriers for us? Be it access, or be it diagnosis or screening, or be it access to the physician himself. So how can technology help us with low-cost interventions at alternate points in the value chain of healthcare delivery? And then finally, I'm a little loath to use this term, big data, because almost I've lost my opportunity to create this as the most exciting day of your life by saying big data, because everyone's so tired of the term. But I use it only because it's shorthand for some concepts that I think are important, and I think can really help us as we move forward. So what is a RoboRep? So in my mind, I kind of imagine, right, our reps today being encased in a robot shell that is all the channels that they could be using and aren't today. Right? And that's almost them waking up and doing half their job from home because they're connecting with so many doctors through so many different channels already as they start their day, doing visits, of course, but continually interacting, not just with one doctor as they do one call, but with multiple doctors in succession in different geographies, different areas, as they utilize the different channels that are available to them. And these are common examples, right, and things we can all do individually. The challenge is actually how do you integrate this information such that you know what's happening to the doctor. I have a very simple rule for, and the guys in the back know this. I will not launch a channel that we can't link to our CRM system. It's a simple rule. It actually creates a lot of restrictions to our organization when you actually try to do it, and a lot of challenges to implementation. But I believe it's how we incrementally build up the RoboRep capabilities by making sure that if I have a virtual meeting, I know which doctors attended, and I can compare the impact of that virtual meeting to the call itself, or to an email promotional campaign that I've sent to that doctor through our rep. And so one of the things we really work on is, or a couple of things really work on to enable this, are first integrated content management. What that means is your marketing team can't create independent programs. They really need to think about content across multiple dimensions, such that content is mapped effectively and you can compare messages across different channels. So I'll give you a simple example. If I have an efficacy message, right, in one format, I need to be able to link that to how I deliver that same efficacy messages in other formats. So if I deliver through SMS, through email, it might look different, it may not look different, they look the same, but I need to at least be able to map that back so I know which messages I'm comparing across channels. Second thing is you need high-end CRM, and that's just reality. You need to invest in it. The nice thing about being in China is we usually have to push investment away because global teams always want to give us money to do stuff. And one of the things that I would encourage you to do, and I think most companies have done by now, is invest in a high-end CRM system. And the one that's more challenging that people maybe don't realize as much is you need actually then to have, some people call it closed-loop analytics, some people call it big data, some people call it different things, but basically you need people and capability on the back end that can take the 500,000 emails, 1.5 million SMSs, the 3,000 virtual meetings, the 100 MSL, real-time medical information calls, the thousands of call center calls, and the keyword aggregation of a Weixin peer group conversation, and put that into a model that lets you actually say which of these is working best, and how do I help people get more effective in terms of their mix across all of these dimensions in a micro-marketing way between the rep and the physician. And the reality is that this is eminently possible, right? You guys actually know this today. If you have ever heard of the Netflix model or Amazon recommendations, I'm sure there's the equivalent in Chinese, and I'm an apologist, I don't know it. But basically, when you get those recommendations about what you might also like to buy based on what you buy or based on what you search, it's generated by this type of analytics. So, RoboReps, I think, is one way to go. And I think we have a lot of the components to fill out the content and the formats in which we can do that. But I think we need a lot of work to do on the back end to really make it effective in the long term. What else can we do? So I think I mentioned before value at alternate points of sale or alternate points in the value chain. I tend to think about three which are really important and can really hurt us as we try to grow our business and provide more value. One is what I would call point of access, point of diagnosis, point of dispensing. And so point of access is basically, is your drug available in the place you want it to be? And generally what we can do a lot of work here, and actually many customers want a lot of help on how do you do electronic health record-driven outcomes research or treatment paradigm development or just pure health economics. And I think this is an area that we, as an industry, should be investing in, and certainly as a company, we're looking at investing in. The other point is point of diagnosis, and I'll mention one program we have here. I think they're in building out a care model in China. One of the things that strikes everyone as you get here is that there aren't any primary care doctors. And what this does is it creates a huge burden on the system to really address emergent conditions in an effective way. And that puts a lot of potential opportunity to help physicians characterize patients, segment patients, help get better utilization out of nurses and other types of care staff. And one program we did recently was introduce a hypertension risk factor screening kiosk at about 300 hospitals around China that allows patients to actually assess their cardiovascular risk prior to entering their conversation with the physician. They get a printout from that machine that says, here's your relative risk. It actually has a QR code that the doctor can scan and links to an app that they have, and actually gives the doctor an immediate assessment of, should I be treating this patient, or which way should I be treating this patient, given guideline recommendations or other data and information. And so that's one way where we're trying to influence point of diagnosis prior to prescriptions actually being written. And then the last one, which I haven't seen too much of yet in China, but was a big, it has been a big drive in the US or in other markets, is really point of dispensing. And that's really been piggybacking on systems, dispensing systems within a pharmacy environment. And so the reality is that systems can generate a lot of control around actual prescriptions by changing the dispensing requirements in their system, either by offering, say, generic alternatives, which was a big thing in the US, or flagging, safety issues with particular products and particular patients based on their records. And getting into these systems and being able to piggyback onto them to improve treatment choices or adherence is an important technological advance that I think we'll see more and more as people get more sophisticated in their use of these types of systems. And then the last thing I'll say about big data is really what are some of the requirements. So this is actually this source is from Google themselves, and their challenge to companies about how they get prepared to do this. Because a lot of people mention it, but it's really not an easy thing to do at all. One is just the people who can actually do it. That's an obvious one. But the reality is that you need to have really thought through your technology platforms to be able to do it effectively. And so, I think the fact that a lot of people sit on Salesforce.com and Viva today actually is a huge step forward, because both those systems are very good at and check a lot of the boxes across these dimensions. The other piece, though, is really data and how you integrate data and make sure your data is compatible across multiple channels, but also across multiple feeds within your company. And then the last thing is culture, which is quite challenging. I think to a lot of people, this is a huge black box. I always had people tell me, when I showed ROIs, back when I used to show ROIs, I don't believe anything you're showing me. So I stopped showing them because no one believed it. And now this is even worse, because at least in ROI, you can kind of conceptually get it. But when we talk about multivariable analysis, I don't even know what that means, to be honest. And I can't explain it to my boss simply. So it's really a challenge to think about how do you embed a culture which relies on this kind of data, which is somewhat limited and intransparent in terms of how it generates some of its results, and also then promote experimentation, because it's not always correct, right? And it's often just helped directionally. And how are you running, not a big program, right? How are you running mini experiments that really test all these different channels, get feedback quickly, and analyze data in more real time? So, conclusions, quite simple, right? Growth is likely to continue in China, but obviously we have increasing pressures in terms of finding cost-effective ways to engage customers and deliver that growth. Our current approaches have largely been on the incremental side or repeating what has been done in other markets, and I think we do have an opportunity in China to go beyond that. by focusing not just on how we reach customers with a message at the right time, but really thinking about how we develop channels holistically so that they're sticky, that they last, and that they're scalable for the size of the business that we have. And then I do believe that technology can really help us do this. And there are many enablers out there, and there are many good ideas, but it will take you not one vendor, not two vendors, but multiple vendors, and putting that together in a coherent strategy for your organization. So the last question, most exciting day ever? Maybe not. But thank you for that.
Thank you, David, for your thoughtful remarks and a lot of food for all of us to chew on today. So we'll open up the floor now for any questions for David.
Can you just say your name and where you're from?
Seth Feldman, from the company currently known as AstraZeneca. My question is this, you talked about the role that you have that requires that any new IT or e-marketing solution you put in place has to tie into the CRM system in order to deliver a concept. How did you take that first step? Because I can imagine at some point in time there were disparate systems that all didn't talk to each other, and in order to realize that vision you have to have them all talk to each other. So how did you make that first step given the complexities involved?
Yeah, I mean, I think, so we kind of made the rule, and then we said, so what fits in, what could fit, right? And how can we make it work? And I can give you an example of one of those. And then what doesn't fit when we stop. So I will tell you, we shut down every website we have. We just shut them down. We don't, if you search for Novartis products on the web, you will not find them in a product website, a traditional product website in China. The second thing, and I know that's a gap, but I don't know how to solve the issue of how do I link it to the CRM system yet, although we are working on that. The second thing, for the stuff we could migrate, or we thought we could migrate, we had to figure out ways. So one simple thing we did was like for app development. So if a team had developed an app on the Reps Launchpad, iPad, that they had been using but didn't link to our CRM system, we basically built a bridge that, basically they had to go to the app from our promotional platform. So we could capture they went to the app. Now the app itself doesn't link to the CRM system, but at least we know they went to the app. So that was a way to kind of bridge some of the investments that we'd already made, and we basically tried to do that relatively systematically. The reality is we weren't as far along as we thought, and frankly, marketing teams like to turn over stuff so much anyway that by a year, people had either killed this, had forgotten about the stuff they wanted to do that didn't fit, or people had changed and left the company and new people were in, so they didn't like the old one anyway, which is a marketing problem, right? Every time you get a new marketing person, the stuff that had been done for the last 2 years is crap, all needs to be redone, so that happens.
Thank you.
Sure. Other question? Behind you.
Thank you, David. I just got a question just now. You mentioned for the improved stickiness for the SCPs. You mentioned personally I come from Johnson & Johnson medical devices. Yeah. So for different medical devices, the surgeons and physicians have their own user habits to get different type of products. But how do you actually improve loyalty for your customers? Because how you differentiate with others? Everybody do the right thing, right message to the right customer with right information. So everybody do the same thing. So how you differentiate with others to improve loyalty? Yes, in your words, like stickiness.
Yep.
Thank you.
So I would, and I'm sorry, I'll pick on you a little bit because you said you provide the right information. And I said you provide the right solution. Right? And I think that's where our model of loyalty is developed. Is that if you just provide information for a doctor, they can get information from a lot of places. And so you really need to think about how you provide a solution to them. And a solution may be very simple things, right? It may not be, I have to deliver the efficacy message. They may say, I get the efficacy, right? But every time I write more than 500 boxes of your product, my director comes down on me and says, why are you doing this? Right? Or I get a letter. They need a solution like that. Right? And you need to help them develop that solution. And I think through multiple channels we can do that. Or, right, patient complains about an adverse event, right? Has a really bad adverse event. You know, a rep, they call the rep's like, oh, I can't really help. And, you know, how do you get them help the right way? Well, real-time medical liaison support, right, through Skype or through, you know, whatever platform you want to use, would be one way you create that solution. And I think it's providing those solutions that ultimately develops loyalty. I don't think it's anything fancy in the sense. You can have the fanciest stuff. Fanciest stuff doesn't develop loyalty, right? I think only Apple can do fancy stuff and develop loyalty. I do not consider myself Steve Jobs, so I don't think that that's, at least from my perspective, what we'll be able to do. So you need to really focus on really solving problems that our customers have, right? That helps build loyalty, and obviously it needs to be a business relationship. So there needs to be, it needs to be benefit in it for you and benefit in it for them. Because a lot of ideas that come up from marketing teams are often, you know, I'll solve every problem the healthcare practitioner has, right? Which may or may not generate business or loyalty. But so the challenge is how do you find those places where it really makes a win-win proposition for you and for the customer. And that's not an easy thing to do, right? It requires you spend a lot of time with customers, you really understand them, and focus much less on what your product message is, but rather how your product offering can offer them value. Oh, one over there. You guys let me know when I have to stop.
It's David Lenon from AstraZeneca. My question is around the channels, alternative channels you mentioned. Some of the channels are social media, which is a public channel.
Yep.
For example, you mentioned Skype, and I think you also mentioned WeChat, which is a social media to the China. So what's the consideration in your real cases that's the compliance issue?
Yeah.
How much you hear about that, and what's the react from the compliance department in the orders?
Sure. There's actually multiple layers of compliance, right, that get impacted whenever you do channels. I think the first one is IT compliance, because you need to be able to make sure that your systems are secure. And if they're not secure, if they're public networks, that you have a method for how you're going to handle any issues that arise in that. The second piece you have, obviously, is your promotional compliance and those kind of things. And the biggest challenge of any promotional compliance is always two-way dialogue. So once you engage in two-way dialogue in anything outside of what would a rep or an event, it becomes less easy to control, right? And you have the opportunity then for off-label discussions or adverse event reporting that also needs to be well managed. But it's possible to manage those things. It's not impossible to manage those things. And then the third, I forgot my third level of compliance, so I'm just overloaded with compliance these days. I think I was going to mention just pharmacovigilance and the adverse event reporting, those kind of things need to be properly addressed. And the last thing I think I remember now is patient-oriented programs. So the reality is if it's a public network, patients could have access to it, and obviously we have we're not allowed to promote to patients here in China, so you have to be really careful about who has access to those public conversations. The reality is that yes, all of those things get in the way. The opportunity you have is getting those people involved early and reminding them that their job is partially to make our company successful also. Right? So I always tell our compliance people, please don't just tell me no, right? Tell me how. And that's the spirit you have to create in those cross-functional teams to make it effective.
Hi, this is Francis from Pfizer.
You're all sitting together now, that's great.
I'd like to ask a question in regards to data. You know, marketers today already has about data. With the new channels coming in, they're going to get more data. How do you embed that culture in the marketing organization to utilize all this data?
Yeah. So I have the luxury that, so I'm a PhD scientist by training, and I did physics undergrad and stuff, and I love data. I love it. I have to hide that fact sometimes from people because it's not always so business savvy when I start to go into data. The nice thing is now we're talking about big data. We can all come out and say, yes, we actually love data, right? And the reality is you find that a lot of your marketing team doesn't know data, right? And that is a challenge. But the reality is they have to learn at least how to utilize it. And I think what IT teams and multi-channel teams need to do is really help people visualize data better. So one of the things we've done is we've tried to move away from Excel-based or online dashboard-based systems. We're introducing one system that's called Tableau, which is a data visualization tool to allow people to more easily interact with data, complex data in particular, and experiment more directly without having to do the algorithms, the database piece, and so the files aren't a mega size either, right? And I think there are solutions out there, and we need to jump forward and start to use some of these. Many of them are really easy. Like, people recognize this challenge, right? There are companies out there who are saying, I can help you overcome this without you having to build up a data analytics team that's 20 people and train everybody on how to use this. So I think the big thing is to really help facilitate that transition in a credible way to people. And part of that, simple things like giving them tools to play with that are much easier than typically what we give people in the organization. Any more?
Any other
Most exciting day ever. Thank you.
Okay.